Good day, everyone. My name is Marianne Laris Batalya, and today I will be discussing about the teaching strategies and classroom accommodations for students with cystic fibrosis. Basically, cystic fibrosis does not affect cognitive or learning abilities. So it is safe to have the same expectations of students with CF as you would other students, including their academic potential and achievements, behavior, and attitude. As future special educators, our willingness and ability to understand a student's health needs as well as their educational needs can have a significant impact on the student's social, emotional, and educational well being. Here are some strategies in teaching students with cystic fibrosis. Avoid an overprotective attitude. Students with CF wish to be treated the same as any other students. Educate other students that CF is not contagious. A student with CF may have an active cough without having a virus. Give special considerations regarding missed instruction, assignments, and testing. Give tests when the student is most alert, as they may not have a lot of energy since students with CF may fatigue easily or they have reduced endurance in comparison to other students. Provide extra time for tests and makeup work. Ensure that the student receives assignments in a timely manner so that the student does not fall further behind. Encourage students with CF to participate in physical exercise, sports, and other school activities. It is fundamental to their treatment, helping to strengthen the lungs, muscles, and bones and assists in clearing mucus from the lungs. Promote hygiene. Encourage all your students to wash their hands with soap and water or sanitizer after using the bathroom, coughing, sneezing, or playing outside at recess. Intervene to ensure a positive school environment. Students with any condition may be a target of bullying and teasing. In addition to setting IEP accommodations in place for a child with cystic fibrosis, school districts can help by providing teachers with general information about the disorder and the ways in which a student may require assistance in the classroom. Teachers can also benefit from learning a few guidelines about cystic fibrosis in children. Here are some classroom accommodations for students with cystic fibrosis. Give time during school day to take medication or do airway clearance therapy. Adjust classroom rules to allow child to take their own medication like pancreatic enzymes. Teachers should ensure that the student is taking the medication as scheduled. Discuss with the parent what type of system will work for their child in terms of administering the enzymes and how many are required for different food items. Students can eat snacks in class as they need to eat more often than an average or normal student. Parents could provide a list of common classroom foods like cupcakes or popcorn and how many enzymes their child may need for these types of food so teaching staff are aware. Homework sent home during absence. Have a plan to get homework or tutor when child is ill or in the hospital. Discuss with parents in advance about possible homework which could be undertaken if the child has to go to the hospital or is at home on IV treatment. Give audio or videotapes of missed classes. Give access to private bathroom, perhaps in a nurse's office. Do not limit access to bathroom. Due to frequent digestive problems and coughing episodes, they may get out of the classroom more often. Unlimited access to water. Always allow the student to carry water. He can drink water at his desk or exit the classroom for water. It is recommended that they do not use drinking fountains as they often contain bacteria that is harmful to those with CF. Have a medical emergency plan. Make sure that tissues are available on the teacher's or student's desk. Air-conditioned classrooms. Exemption from attendance policy, for students with CF frequently miss school. Preferential seating. Student is moved away from other classmates who are sick. Extra time to complete tests, homework assignments, and grading. Modification of workload to accommodate health status, fatigue, and absences. Physical education adjustments due to heat intolerance, physical limitations, etc. Second set of books at home. For the student who is recovering from a lung infection may not be strong enough to carry heavy books. Participation in all extracurricular activities. Evening, sports, field trips, and overnight events included. Self-testing of blood glucose. Self-administration of insulin via needle or insulin pump. Daily reports of blood sugars to parents.